For the purpose of demonstration, we're using ungloved hands. Placement of the Redsense catheter patch. Remove the Redsense catheter patch from the sterile pouch. Remove the paper covering the adhesive. And place the hub of the connection between the bloodline and the catheter on the pad. Fold the patch over to form a sealed pouch. At the end of treatment, find the pull tab. Gently pull back on the pull tab. Gently pull back on the catheter sensor patch and remove. Dispose of the catheter sensor patch properly. You will also want to wipe the alarm unit itself and the fiber optic extension off with an alcohol-based disinfectant.